to another episode of the Current Review. My name is Tebogo Kotsi, and I come to you live on Central News, the platform where it delivers great news to everyone at any given time. And today it's our episode 63 of the Current Review. And as you all know, the Current Review, we're all about reviewing the current news that are actually taking place. And we will be having discussions about everything that is happening. You've seen even in America where there's new developments when it comes to the voting that side, whereby it seems like Mr. Donald Trump is leading, but it's something that we'll touch on later. But if you keep your eyes glued out on other social media platforms, you'll see that. But today on the Current Review, we'll be talking about the burning issue that has been taking place in the Free State, whereby we saw a group of health employees within the Department of Health. And these are employees that were contracted during the time of COVID to help the department in terms of the pandemic that took place. And we all saw them, they've been protesting because in terms of their contract, they did state over their contract were not renewed or continued, so they are currently unemployed. And yeah, it's been a very posing issue when it comes to that particular development, whereby we saw that the health workers ended up camping outside the Premier's office, saying they seek answers in all of that. So in all that midst, we'll be talking to the MEC for the Department of Health in the Free State, which is Unsaid Mahlatsi. And he will be giving us a brief background because you know what, sometimes we need to have a conversations with the principals of that department who give us a big background in terms of what's going on, what's the status in terms of that, or why we're sitting with 1,300 COVID-19 support staffs that are no longer in service. So MEC Mahlatsi, welcome to the Current Review.
Thank you very much, Ndate. Let me greet you, your team, and the viewers at home. It's an honor to be here to get the opportunity to share the information in relation to the current developments.
And I'd like to thank you for availing your time during your busy schedule for that. And I want to know, these employees, it has been mentioned that the employees that were contracted during the pandemic, and we all know that the pandemic has basically not come to an end completely, but we are stable. And I just want to understand what happened, how did we come to that point where contracts were not renewed and the decisions behind that?
Thank you very much for the question. And like I indicated, it's always, a good opportunity for us to explain because we can never have enough conversation about any topical issue. Yes, as you have correctly placed it that in 2020, the president of the country declared that we're facing a pandemic, and the experts in a form of the advisory committee that was attached to the office of the minister and advising as well the president advised us on the possible infection and possible complication numbers. The complications resulting from the infections. And based on that, there was planning that was done, and that planning included erecting or renovating some facilities to accommodate the numbers that were predicted for us to face. And attached to that was the issue of complementing the staff complement that we had at the time. And that I think that has become the topical issue now. In that from 2020, there were workers who were contracted to assist the country to fight against COVID-19. And in the beginning, there were about 1,200 that was there. A year later, it was around 1,500. The year later was about 1,600. And as it stands now, we're talking about an amount of 1,257. And the money that national government gave us, because this was a national intervention, they gave us an amount of 128 million for the first year, but our expenditure was at 480 million. The following year, they gave us 200 and something. I can't recall if it was 250 or 260, but our expenditure remained, was about 500 million for that year. And from 2023, the 2022, because the infections didn't reach the levels that were expected, the grant began to decline to an extent that at some point we were receiving 400 and something million. At this stage, we only receiving 250 or 260 million from the national government. And our appointments of contract workers were attached to the value of the grants that we were receiving from national. And as it stands now, we received an amount of 250 for the current financial year. And the expenditure, the wage bill for every month for workers who are on contract relating to COVID-19 contracts, we're spending 33 million. And if you divide the amount of 250 by 33, you only get to be able to pay 7 months. And when that 7 months lapses, the money is finished. Now we were faced with a situation to say, do we keep the workers knowing fully well that will not be able to pay when the salaries fall through? And the decision, the advice that we received was that that will not only be inhuman, it will also be illegal, because you can't ask people to work and you are not able to pay them. And even though there's going to be a grant next year, we can't be saying work now, we'll pay you with a grant next year, because of the tight regulations that are here now in relation to the Public Finance Management Act. That could lead to myself, HOD, and the CFO going to jail.
Now, I hear you, especially when it comes to the financial element of it and the financial constraints. But in terms of the health department, we know that we've been experiencing a bit of a challenge, especially when it comes to shortage of staff. Now that you're going to be having a shortage of more than 1,300, isn't this going to affect your system?
Well, there's never been two ways about that matter. From the onset, there's never been dilly-dallying about it. To say we need those 1,257 to remain in our system. In fact, we need to appoint another 1,257 so that we have 2,000 and something, because we have a lot of the demand for healthcare services does not meet the supply. The demand way outstrips the supply, and one key factor is the non-availability of enough staff to assist us to do this work. So that is why when COVID didn't reach the level that were expected, we then reallocated the staff to areas where there is a need. And even now, there are facilities that have been very hard hit by the non-renewal. But we're doing our best, and already we have appointed about 350 of those workers. And even now, since 8 o'clock in the morning, I just came out now to do the interview. I'm going back into the meeting. We're also meeting again at 8 o'clock tomorrow. We're working on a plan that will seek to ensure that the service delivery is not affected that badly in the front line of our healthcare delivery point.
Earlier, you spoke about a grant that the department gets from National that actually gets to assist with these workers. And you mentioned that the grant is only going to come next year. In the current financial year, you cannot close the whole entire year. Is there a possible way that the department is looking into in terms of absorbing those contract workers into the mainstream line? And is there some form of communication with National, because this is becoming a national problem, especially when it comes to unemployment rate? Is there some form of intervention that National and the department is looking into in trying to absorb them?
Thank you very much for the question. And our ideal resolution to this matter would be all these workers being able to be appointed permanently within the department, so that we can be able to start looking for how do we still increase the numbers, because we need quite a huge number of staff to be able to do the work. Now, the situation that we are facing now is that we're working very hard to ensure that we get sufficient funding to resolve the matter. I mean, my first month when I was here, when I was appointed in July, I was already at the office of the minister, Dr. Aaron Mtswaledi, raising the very same issue to say, Minister, we have a problem. We can't afford to lose these workers from our system. And the minister indicated that the budget is very strict, is very, he will not be able to respond immediately, but he will look into that because the budget is very tight these days. So that matter is still receiving attention at this level, but we've raised the matter with the Premier as our political head in the province, and the Premier is currently dealing with the matter. We having consistent meetings with her in exploring a number of options. We have had presentations with and meetings with provincial treasury, and indicating to them that there are a number of government programs that have been run. But in health, we're dealing with people's lives. And with people's lives, you can't go back and reverse. When a life is lost, life is lost. So we expecting one of those could work out properly, could work out for the better of the solution now. But since the beginning of the week, in fact, from last week, our team internally within the department, they've been in a project of ensuring that we reduce expenditure where it is possible and be able to add to the ground and ensure that and try our best to get as many workers as possible into the system on a permanent basis.
Now, MEC, we've seen these workers actually protesting outside the Premier's office, either staging a stay, saying that they are unhappy about the current situation, of which we understand. But has the department actually reached out to them and actually communicated these plans that they are planning to intervene in order? Because it's causing a bit of a problem due to the fact that I'm seeing even your affiliates like your SACP and EFF, they are also raising this issue, and it's becoming more of a political matter. So has the department actually reached out and actually intervened to have a conversation with these current unemployed employees?
Firstly, the workers whose contract came to an end and we could not be able to renew, they were engaged by the managers in their respective places of work. And the situation was explained on several occasions to them. We expected that, under normal conditions, you would expect that when somebody is in a contract and the contract comes to an end, then the person will then accept that the contract has come to an end. But we're dealing with work and employment here. And it's not only about coming to work, going home. It's about providing bread and putting bread on the table for a number of people. And if you talk about 1,257, knowing fully well that one worker is taking care of a number of people in terms of providing for them, it's a very huge number. So because of that, there's a lot of emotional stress that comes with it. And I want to believe that those workers are facing very tough realities in their faces, and them taking that out in a form of engaging in a protest, they are justified, and one cannot say really what they are doing is wrong, because they are the ones who are being pinched by the shoes that they wear.
So MEC, this issue also comes and it affects issues of staff morale, because when you're seeing your co-workers actually their contracts not being renewed and they're being unemployed, it also affects that staff morale, whereby there tends to be a negative environment that flows. So as the new MEC of the department, what steps will you take or have you taken in order to actually boost the staff morale, just only so that the current working staff doesn't feel this is becoming too much for them, also due to the fact that majority are already crying about being short-staffed and being overworked. How do we bridge that?
Since my arrival, I've started a number of projects internally to try and boost the morale of the staff, but also to improve patient or customer experience in our facilities. And one of those key things is that after my first month in the department, I realized that we have a serious challenge with our frontline staff. And they were taken to an induction and some kind of training in relation to Batho principles and other related policies that will seek to ensure that our clients and our patients receive the best of care at that particular point. Yes, when conditions worsen in the workplace, people's morale will generally be affected negatively, but we are there are some things that we are engaging in to try and boost this. And one of them is constant communication. And one of them is the honest communication about what is it that we are going to be able to do and not being able to do, because we can't give workers false hope. We can only commit that we're doing our best in relation to this matter. But the fact that in the past 2 months, during my intervention on these issues, we have been able to absorb about 351 of those workers who were on a contract. I think that's a sign that shows that we are really committed into resolving this problem, and there's a lot of progress in our view in relation to that, and we still expect that we'll be able to absorb even more. So my call to all the staff of the Department of Health is that please stay focused, please continue to execute your duties. As part of the leadership of the department, We're doing everything that we can in order to find solutions. And we always open for creative ideas that can assist us to overcome this challenge. Yes, we will not be able to boost the morale by just speaking. And that is why I'm mentioning what has happened, in order that something that is, dampening the morale should then be seen as being something that, to a certain extent, some solutions have been found about it. And when we say, please be patient with us, at least there will be some progress that our workers can then be able to observe.
And let me see, just my second last question before we close, because I don't want to keep you long due to the fact that we have to go. Rural places tend to be affected by such decisions, and we tend to see them actually getting a huge impact when it comes to service delivery. Now, you having losing so much staff members, how is the service delivery? What have you picked up and noticed in the rural areas? And I'm talking about your Putsanes in Tabanchu or Pudu. How has that affected it, and what intervention has the department taken? If
Thank you very much for that question. And the information that is coming through is that generally Bloemfontein was an area. I don't want to use Mangaung because the focus was mainly in Bloemfontein, particularly because of the levels of healthcare that are provided here. This is the area where a large number of contract employees were employed, and it's a number so large that it's even bigger than the rest of the province. And because of that, we're expecting that a bigger impact will be on Bloemfontein. And that is why we're working on that to make sure that we're able to manage this situation. When we talk about the rural and smaller towns, for a lack of a better word, they are not that much affected by the issue of COVID contract, because the anticipation was that those who will be affected by COVID contract will be either from Bloemfontein or will be transferred to Bloemfontein. So the bigger chunk of our challenge lies here, and we are finding ways to deal with it. At the right time, I'll make a full disclosure about this, but because there are ideas that we are pursuing, I cannot disclose them now.
Okay. No, that is very fine, MEC. Any closing remarks from you as the MEC for the Department of Health to the employees and the current employees that are currently working?
Just two things from my side. To the current employees, as the MEC of Health in the Free State, I'm really humbled by the work that's been done by these professionals and other workers that are, let me say, by the healthcare workers in general in the province, that despite the challenges that we continue to face, we continue to have men and women who are committed to changing lives of our people. And I'm really humbled by that. And I really wish to say a word of gratitude to all of the healthcare workers in the province, and assure them that we working round the clock to ensure that these challenges that we are facing are resolved. If you allow, may I also say a word to the community of the Free State that we serve, and just two things in relation to that. Firstly, we're facing a huge challenge where our property is being vandalized. Just the other day in Virginia, there are people who broke into our clinic at night, didn't steal anything, but they smashed everything, including the toilets, the bathtubs, everything, the sink and everything. So we're just appealing to our society to please assist us to protect the public property, because this property is designed to help you. The final thing that I would like to raise, I would like to urge parents to take responsibility on what their children are eating on a daily basis. Our children like buying snacks all over, and as we speak now, we're facing a challenge whereby a number of children from Dalutolo school in Velcom have been taken to Bongani Hospital because of suspected food poisoning. So my appeal is that can as parents be vigilant and ensure that we know exactly what our children are eating, and rather provide lunch boxes for our children, because that will be even more nutritious, more than the snacks that they buy at schools, because that has not been guaranteed that is safe. Thank you very much. May you have a blessed day to you and your viewers as well as your team.
Thank you, MEC, and thank you. And it's something that we'll also address from our side, given the fact that we're sitting with a huge crisis of food poisoning that is happening currently in our country, all over the country, where we are, like you did mention, the kids are actually consuming something that is very bad and very critical. But it's something that will make the public aware of, and also address the issue of vandalism that you did state, because people must stop vandalizing their properties due to the fact that it's setting us back as a community and as a country also. It's something that we also, as the media houses, that we also need to address with all our listeners and all our viewers, just only to help us, even go as far as assist the departments by actually reporting such matters. But it's something that we'll definitely address. Thank you, MEC. Let me not keep you. Thank you for availing your time. And we will be back just to catch up with you also later on during the course of the year, for you to give us more of your highlights in terms of how it has been in office.
I'll be very delighted to share my thoughts and my experience about that. Thank you very much.
Thank you very much, MEC. And ladies and gentlemen, that's the MEC Mahlatsi from the Department of Health in the Free State Province. And as you just heard, our current employees that have been, their contracts have not been renewed. There is intervention that the department is taking place. They are in communication with National. He did indicate that there is a grant that is going to come through from next year that they're actually looking into, but there are current processes that are taking place in order to sort out the situation. So to all the employees out there, just, bear with the department, always be in. That's why we even touched on issues of communication. And in other news, it is official. Mr. Donald Trump, the big man himself, is just taking the podium. He's back in office. He's been elected, if I'm correct, it's the 47th president of America now. And this is his second term. Like, he took a gap year, then he came back. It is official. And I was looking at the markets, funny enough, immediately this is 137, at 120. The market, the JSE, dropped. If we pay attention to the markets, especially when such news happens, when there's new developments in America, they always said whoever is going to be president will determine how the markets are going to perform. Now I'm seeing it. I'm actually looking at it as currently as we're talking, or it has went down. I don't know, Bonks, they can see it on this one. That's how I've been analyzing the market. But as you all know, Donald Trump is back. I don't know what it means for America. I don't know what it means for the current court cases, because we all know, we saw in the past that Donald Trump, they were trying to remove him. They tried to prosecute him. They tried to do so many things. But the man fought back, and he's back. And like he always says in his great words, when I come back into office, he's back. So it's the latest developments that we will be keeping a close eye on it as Central News and the current review. And we will also be in communication with other people who will be bringing you new things. And I think from next month, December, you'll be seeing a different show. Look on now, you see, there's new developments everywhere. There will be developments that are going to take place. But ladies and gentlemen, thank you for tuning in and dedicating your time. Don't forget to subscribe to our pages, all our social media platform. You find us there. It's called the Central News. You'll find the current reviews. Please go like, subscribe, share our pages, invite your friends to it, because we are the one media platform that will deliver the greatest news to you at all times. And I give you my word that we will deliver you the greatest news, breaking news at all given times. And like we said, America has a new president, and Free State is still growing at the end of the day. We shall make sure that it happens. My name is Tebogo Kotsi, and this is the